Jasmine Crockett challenges. Bill that could shut down rural hospitals. Reactions explode. That question echoed across the Capitol hearing room, sharp enough to freeze the cameras. It wasn't just another budget debate. It was a war over priorities, and Jasmine Crockett stood in the eye of it. At stake, a controversial clause in the big beautiful bill, a sweeping reform that proposed slashing Medicaid expenditures by tightening eligibility and cutting provider taxes. Proponents, including Caroline Leavitt, called it necessary housekeeping. Critics warned it would wipe out hospitals in rural communities already hanging by a thread. The room was charged. Elderly constituents filled the back row. Reporters leaned forward. Somewhere in Iowa, a clinic watched the live stream. Jasmine wasn't there to play party lines. She was there for the people who didn't have lobbyists, who didn't have second chances. People like her mother. People who waited hours in emergency rooms or skipped treatments to keep food on the table. This wasn't left versus right, this was survival versus strategy. And the nation was watching. What are we really cutting? The fraud or the future of rural America? That question echoed across the Capitol hearing room, slicing through the murmurs, slicing through protocol. 1,000 thoughts collided in that silence. Journalists lifted their eyes from notepads. Phones tilted upward to record. Jasmine Crockett had just asked what no one else dared frame so bluntly. The backdrop was the most divisive legislation in months, the big, beautiful bill. At the surface, it was a budget package, but buried deep within its text were sweeping reforms to Medicaid capping provider taxes, tightening eligibility standards, and rolling back expansion incentives. To the administration, it was smart policy. To hospitals in rural America, it was a potential death sentence. And Jasmine knew death was not a metaphor. 2 days earlier, she had flown into the district of one of her colleagues for a funeral. It wasn't political, it was personal. A distant cousin, James Crockett, had passed away after a stroke. He lived 3 counties from the nearest neurologist. By the time help arrived, it was too late. Jasmine didn't cry in public, but she sat in the pew jaw, locked, watching his 2 daughters weep over an avoidable outcome. She'd known the numbers. Now she'd lived the fallout. So when she entered the hearing room on Monday, her notes weren't just bullet points. They were stories folded and pressed behind official testimony. Caroline Leavitt was already seated when Jasmine arrived. Polished, poised, and holding the line on fiscal responsibility, Caroline had become one of the loudest voices advocating for cleansing Medicaid. She wasn't heartless, but she was strategic. To her, unchecked spending was a long fuse burning beneath the economy. "Let's not confuse compassion with mismanagement," Caroline had said the week before on national television. "The fraud rate is unacceptable. The abuse is rampant. Medicaid is being drained by non-citizens' redundant filings and outdated structures. We fix it or we lose it." The statement had gone viral. Now, facing Jasmine across the hearing room, she kept her tone measured. "We're not gutting Medicaid." Caroline began, her voice firm. "We're modernizing it. We're ensuring its survival by enforcing discipline. And yes, we're acknowledging that over 1.4 million non-citizens are pulling from a pool meant for American taxpayers." A rustle passed through the room. Jasmine didn't respond immediately. She waited, because sometimes silence has a pulse of its own. Then she stood. "The question we should ask," she said, eyes scanning the chamber, "is who do we save when we say Americans?" She tapped the screen beside her. A map appeared. 27 rural hospitals, highlighted in red, all at risk of closure within 12 months under the proposed provider tax cap. Each red dot, Jasmine said, isn't a statistic. It's a town, a zip code, a heartbeat. She clicked again. The screen zoomed in on McLennan County, Texas. 1 hospital, population 13,000, nearest emergency department 94 miles. "Let's be clear," she continued. "This bill doesn't cut fraud. It cuts oxygen, it cuts beds, it cuts lives." Caroline interjected. "With respect, we are targeting inefficiencies, not emergencies. We are closing loopholes, not doors." Jasmine didn't blink. "Tell that to the woman in labor on that 94-mile stretch of highway." Her voice was calm, but her words carried weight like sandbags in a storm. The committee chair, trying to retain decorum, motioned for order. But the air had changed. The hearing wasn't about numbers anymore. It was about narratives. Outside the chamber, Twitter was already ablaze. Medicaid battle, Jasmine's Caroline, hospital lines matter. Back inside, Jasmine brought out her next point. Let's talk about my Uncle Ray, she said. A Vietnam veteran, diabetes, COPD, lives in a town with no urgent care. Last month he rationed insulin to make rent. Is he not American enough? Caroline didn't answer immediately. And maybe that was the most honest moment of the day. Because in politics, hesitation often says what strategy can't. Jasmine pressed on. We need reform, yes, but reform that builds bridges, not barricades. That protects taxpayers, yes, but doesn't abandon the vulnerable in the name of math. She closed her binder. This isn't about free rides, it's about fair chances. The chair recessed the session for 5 minutes, but the echo of Jasmine's words didn't pause. It spilled into social feeds, morning shows, town halls. And somewhere in a quiet home in Missouri, a 72-year-old veteran, watching C-SPAN, wiped his glasses and whispered, "That's the first time someone remembered I exist." The hearing resumed with a different energy. The room had recalibrated. It wasn't just a political event now. It was a moment. A fracture in the marble walls of the Capitol where truth tried to squeeze through before spin sealed the gap again. Caroline Leavitt returned to the microphone first. Her tone was precise, her delivery practiced. We cannot ignore the numbers, she said. According to the latest GAO report, fraud and abuse in Medicaid have cost taxpayers over $36 billion annually. That's not theory, that's theft. She paused to let that word hang. This bill doesn't target the sick or the poor, it targets a system that has grown too bloated, too reckless. Without these provisions, we risk losing the very foundation of Medicaid itself. Some nodded. Others scribbled. A few leaned back, arms crossed, waiting. Then Jasmine stepped forward. She didn't raise her voice. She didn't need to. Her conviction spoke louder than volume. The GAO report also states that much of that waste is due to mismanagement in verification systems managed by states and federal agencies, not by patients, not by seniors, not by children with asthma or veterans with PTSD. She pulled out a printed document. Here's a study from the University of Michigan. 89% of Medicaid recipients flagged for irregularities were later found to be eligible, just trapped in paperwork errors or outdated records. So let's not confuse glitches with guilt. A low murmur rippled through the gallery. Caroline countered. Glitches or not, the result is the same taxpayer dollars misspent. Jasmine nodded slowly. Then fix the data infrastructure. Invest in oversight, not overreaction. Audit the systems, not the sick. She tapped the desk once. Because this bill doesn't fix inefficiency, it shifts it from budget lines to body bags. Gasps, audible this time. The chair warned against inflammatory language. Jasmine apologized. But she didn't retreat. A senator from Ohio, Republican, raised his hand. Congresswoman Crockett, do you deny that Medicaid is being exploited by undocumented immigrants? She turned. No, Senator. I question the scale, the framing, and the solutions. Are there abuses? Yes. Should we act? Absolutely. But we don't amputate a limb for a paper cut. More murmurs. Caroline responded. With respect, it's not a paper cut when entire state budgets are hemorrhaging. Jasmine sighed. Then why does your bill cut provider tax ceilings that directly fund rural ERs? Why not start with fraud detection tech, cross-state verification, real-time eligibility software? Silence. The chair called the first expert witness, Dr. Rami Patel, health economist from Johns Hopkins. Data suggests that while fraud exists, the long-term cost of care denial due to underfunding outweighs short-term savings by a factor of 3-1. The economic loss from hospital closures includes employment emergency services and public health deterioration. Caroline raised her eyebrows. Doctor, are you suggesting we let fraud continue unchecked for the sake of economic ripple effects? No, Dr. Patel replied. I'm suggesting we weigh harm accurately. Cutting coverage to prevent potential abuse is like banning driving because of speeding tickets. Jasmine leaned forward slightly, eyes locked on Caroline. This isn't about extremes. It's about balance, about nuance, about serving, not punishing people. The gallery clapped lightly. The chair banged the gavel, order restored. But a current ran through the room. Then came a surprise. Senator Armand Blake, a senior conservative voice from Kentucky, asked to speak. "I've run on fiscal responsibility for 20 years, he said. But my district lost 2 hospitals since 2017. One of them treated my brother-in-law when he collapsed. That place is gone now. I just want to ask, are we really protecting Americans or protecting numbers?" Neither Jasmine nor Caroline replied. Because sometimes the most political moments are also the most human. Blake turned to the chair. "Madam Chair, I move we recess for expert panel deliberations. This isn't just a policy choice, it's a generational shift." Motion accepted. Outside reporters swarmed. Pundits prepped for evening shows. Hashtags spread. But inside the Capitol, as the room emptied, Jasmine gathered her notes quietly. Caroline walked past her. "You're better at this than I expected," she said. Jasmine looked up. "It's not about being good. It's about being right for the people who never get a mic." Caroline nodded. Just once. No smile. Just recognition. The panel reconvened the next morning, but the mood had shifted. This wasn't a follow-up, it was a reckoning. Citizens, activists, hospital administrators, and policy wonks packed the public seating. Security was tighter. Cameras were brighter. The stakes were clearer. The first to testify was Dr. Alma Rios, a soft-spoken yet firm physician from rural New Mexico. Her practice, she explained, served over 18,000 residents scattered across 3 counties. "If this legislation passes," she said, "we will have to close our inpatient wing within 6 months. We've already cut prenatal care down to 2 days a week. Women are being told to hold on while we look for hospital beds." Her voice cracked but didn't break. "One of my patients gave birth in the back of a truck on a dirt road. She had complications. We barely saved her. The baby almost didn't make it." A long pause. Then came a ripple emotion, quiet and heavy, filling the room, like water in a tank. Caroline Levitt glanced at her notes. She adjusted her blazer. "Dr. Rios, I admire your service, but don't you agree that systemic fraud, if unaddressed, will eventually bankrupt these same services?" "Fraud is real," Dr. Rios said. "But so is abandonment. We can fix systems without breaking people." Next was Matthew Chang, a former federal Medicaid auditor turned whistleblower. He was analytical, data-driven, and carried an air of someone tired of bureaucracy. Of the $3.7 billion flagged as waste last fiscal year, over 60% was due to back-end system failures, duplicate files, misclassified incomes, outdated residency logs, he explained. "These are correctable with software, not policy knives." Caroline pressed him. "So you're saying patients aren't responsible for any part of this waste?" "Some are," he replied, "but most are just surviving. You want accountability? Start with states that haven't updated eligibility databases in 15 years. The room stirred again. Jasmine took the opportunity. "Mr. Chang, in your experience, how many patients have committed intentional fraud versus unintentional filing errors?" "Maybe 1 in 200, he said. "And those cases are usually discovered through routine audits, not because hospitals turn people away." That landed. The chair leaned forward. "Thank you, Mr. Chang. We'll now hear from community leaders." Angela Burns, director of a nonprofit health network in rural Tennessee, approached the mic. "Our Medicaid clinic sees 60 people a day. Most are older than 60. Many are veterans, farmers, retired teachers. They worked, they paid in, they believed they'd be protected." She held up a manila folder. "These are letters from patients, real stories. Here's one from Mary, 72, who delayed treatment for breast cancer because she couldn't afford gas to a hospital 2 towns over. She's now in stage 4. Angela's hand trembled. Is this how we reward her lifetime of work, by letting her fade out alone, undocumented not as an immigrant, but as a forgotten citizen? Another ripple, another silence. Then Caroline surprised the room. Ms. Burns, thank you. I'm not here to villainize Mary or any patient. But as a nation, we have to make tough calls. Isn't it tougher to tell a working mother her paycheck barely covers rent because taxes are soaring? Jasmine jumped in. Isn't it even tougher to explain to that same mother why her child can't see a doctor for a week after breaking his wrist? The moderator called for order again, but the fire had already caught. Behind the scenes, social media picked up quotes in real time. We can fix systems without breaking people. Abandonment isn't policy, it's failure. The committee then welcomed Dr. Emil Torres, a global health ethicist. We are not merely debating cost-saving measures, he said. We are setting moral precedent. Once you create a budget that weighs human lives against software efficiency, you have commodified citizenship. Caroline shifted in her seat. Are you suggesting we ignore fraud for the sake of moral optics? No, Torres said. I'm suggesting that a country is not strong because it can cut its budget. It is strong because it can sustain its people with integrity. A beat passed. Jasmine whispered to an aide, then asked the chair for one more slot. The chair nodded. Jasmine invited an unplanned speaker, Samuel Hollis, 68, retired coal miner from West Virginia. He walked slowly, but stood tall. I worked 42 years underground, paid every tax they threw at me. Then my wife got sick, lung cancer. We spent everything, sold the truck. Medicaid saved her treatment just barely. He held up a worn photo. Now she's in remission, but under this bill our clinic might close. Then what? His eyes watery but defiant scanned the room. Y'all sit in chairs debating terms like systemic abuse and provider caps. But we live it. You cut this, you ain't cutting waste, you're cutting breath. No one interrupted him, no one dared, and in that stillness the nation was watching. The hearing resumed in the afternoon, under brighter lights, higher tension and clearer lines drawn in the sand. The witness testimonies had hit their mark. They hadn't shifted ideology, but they had humanized the consequences. Caroline returned to the mic first. I appreciate every voice shared today, she began. I respect the lived experiences, but leadership requires hard truths. Fiscal collapse doesn't wait for moral clarity. We must ensure long-term viability before emotional response. Jasmine interjected, her tone sharp but respectful. And policy cannot be crafted in a vacuum of empathy. Viability without humanity is still failure. The chair raised a hand, asking both sides to proceed in turn. The next speaker was Senator Ricardo Jensen, a moderate Democrat from Colorado. Known for his swing votes and pragmatic thinking, he had yet to declare his stance. Both of you make compelling points, he said. But the numbers need reconciling. How do we bridge the data gap between fraud prevention and community preservation? Caroline responded. By introducing verification reforms, real-time tracking, and eligibility recalibration, and yes, by temporarily reducing provider caps in high-spend areas. Jasmine challenged it. You say temporary, but rural communities live in permanent scarcity. Remove funding even briefly and the infrastructure collapses. Once a hospital closes, it doesn't reopen because Congress changed its mind. That drew a few nods, including from unexpected corners. Then came Senator Geraldine Moore, a conservative from Indiana, who broke protocol by referencing her own state's struggles. My hometown lost its ER last year. Since then, overdoses are up 30%. Response times doubled. We saved pennies and lost people. Her voice was tight, not angry, haunted. Caroline looked toward Moore. Senator, we are working on mobile clinic expansions. Cost-efficient, flexible, faster to deploy. Jasmine responded before Moore could. Mobile clinics can't replace trauma centers. You don't treat a heart attack from a van parked beside a cornfield. The gallery murmured again. Cornfield clinics began trending online. The chair called a brief recess. Reporters swarmed the hallway. Sound bites were already spinning into headlines. Hospitals don't reopen just because Congress changes its mind. You don't treat a heart attack from a van. Inside, Jasmine sat quietly going over her notes. Caroline across the room sipped water and checked her phone. Both women were poised but not immune to fatigue. During the recess, Senator Blake approached Jasmine privately. "I don't like your politics," he said. "But I liked what you said about your uncle. That was real." Jasmine nodded. "That's the problem, Senator. Most of this is real for people like him, and we only get one chance to get it right." Back in session, the final speaker of the day was invited Eleanor Price, a retired nurse turned health advocate. She spoke calmly, but with fire. "I've held hands with people dying because they waited too long to seek care. I've called family members to tell them their child didn't make it. I know what delay costs, and I know that rural clinics aren't line items, they're lifelines." She turned to both Caroline and Jasmine. "You both want what's best. I believe that. But if your idea of what's best doesn't include the farmer who can't afford a second opinion, or the teacher who gets cancer 3 years before Medicare kicks in, then you've missed the point." For once, no one had a rebuttal. The chair thanked Eleanor, then announced that the hearing would resume the next morning with fiscal analysts and independent budget projections. As the room emptied, Jasmine turned to Caroline. "I'm not here to win," she said. "I'm here to protect people who don't get invitations to this table." Caroline replied without malice, "And I'm trying to make sure that table doesn't collapse." 2 truths, 1 room, and the nation still watching. The next morning the committee reconvened for fiscal testimony. The hearing had drawn national attention, but now came the numbers, the balance sheets, the projections, the part of politics that most viewers would tune out unless someone made them care. Jasmine knew that. But today she wouldn't be doing the heavy lifting alone. The first speaker was Martin Delgado, a senior analyst from the Congressional Budget Office. With a tone like a spreadsheet and facts like bricks, he laid out the numbers. If all Medicaid reductions proposed in the bill are enacted, he said, we estimate a federal savings of $48.7 billion over 10 years. However, these cuts would likely lead to the closure of approximately 19% of rural hospitals that currently rely on provider tax reimbursements. That number hit hard. The room shifted. Job losses in the healthcare sector would number in the tens of thousands. He continued with secondary economic effects projected in housing, transportation, and education access in affected regions. Jasmine followed up immediately. Mr. Delgado has the CBO projected mortality impact for rural populations as a result of decreased access. Indirectly, yes, he replied. Based on historical modeling, preventable mortality rates may rise by 3 to 6% in high closure zones. She turned to the gallery. In plain English, people will die. Caroline was ready. And in plain economics, she said, unsustainable programs will lead to broader collapse, putting more lives at risk down the line. This bill isn't cruel, it's preventative. The back and forth resumed, but something shifted. For the first time, Jasmine and Caroline weren't interrupting each other. They were engaging, challenging, responding, not attacking. Next came Isaac Feldman, a public health researcher. The most efficient solution, he said, is not funding more or less, but smarter. Risk-adjusted reimbursements, digital verification systems, regional waivers, he looked up. But none of that matters if political will dissolves before implementation. A brief silence. Then Jasmine did something unexpected. She agreed. Dr. Feldman is right. Reform is overdue. Medicaid must evolve, but reform must not come at the cost of real people in real towns with real needs. Caroline nodded slowly. Let's build a system that works but doesn't punish while we fix it. The chair smiled faintly. We may actually be getting somewhere. Outside headlines began to change tone. Compromise in sight, unlikely allies. Crockett and Leavitt trade ideas, not insults. The final speaker of the day wasn't a politician or an analyst. It was Charlotte Lewis, a 66-year-old black woman from Georgia. She didn't come with charts. She came with truth. I'm here because I don't know if I'll still have a doctor next year. I'm raising my grandson. His asthma's bad. I worked my whole life, paid my taxes. Never thought I'd beg to keep a clinic open. She held up an inhaler. This little thing costs $108. Medicaid makes it $3. Without it, my grandson wheezes in his sleep. No one said anything. She stared at them all. You fix fraud good. You protect budgets fine. But don't you dare forget us while you do it. She walked away slow and proud. No applause. Just the sound of reality settling in. The hearing was over. The microphones were turned off. The chairs were emptying. But something hung in the air, not just a conclusion, but a question. What now? Jasmine Crockett stood just beyond the raised platform, gathering her papers. Caroline Levitt walked past her, slowed, then stopped. For a moment they didn't speak. Then Jasmine said, "We didn't solve it." Caroline replied, "No, but we made them listen." Outside the headlines were less certain than before. Not winners and losers, but tensions and terms. Americans across the country had tuned in, not just to watch, but to decide. The camera crew from a national network asked Jasmine for a closing statement. She walked to the press stand. No fanfare, no podium, just her voice. This debate wasn't about me, or Caroline, or politics. It's about every American who's ever waited too long in an emergency room. Every caregiver who's skipped meals to buy medicine. Every veteran who's wondered if their sacrifice came with a return policy. It's about mothers working 2 jobs. About truckers managing chronic pain. About grandparents choosing between rent and prescriptions. She looked directly into the lens. If you're over 40, you know the promises. You've paid in. You've earned your say. If you're over 60, you've lived enough to know what works and what breaks. If you're a nurse, a teacher, a farmer, a factory worker, a home health aide, a retired janitor, you matter. Your health matters. Your dignity matters. Your story matters. She paused, drawing in a breath. This bill may pass, or it may fail, but the system will still be here. And so will the people waiting, hoping, surviving. The real question isn't what happens next in Washington. It's what happens next in your neighborhood, in your county, in your family. She softened her tone. The real question is, what kind of system do you want to inherit? Protect or pass on one that audits pain, or one that heals with integrity, one that closes doors in crisis, or one that opens access with purpose and care. She didn't drop the mic. She handed it back. Caroline gave a similar interview, but with a different lens. We have to protect taxpayers. But that doesn't mean ignoring people. Reform and empathy are not opposites. We can balance budgets and protect dignity. We must innovate, preserve, and yes, listen. We can do all 3. The next day, opinion pieces flooded in. Some hailed compromise. Others demanded clarity. But one thing was certain. The American people were no longer silent spectators. From the cities to the farmlands, from Phoenix to Pittsburgh, from single moms in Cleveland to retired coal miners in Appalachia, people picked up their phones. They called their reps. They wrote letters. They shared stories. Jasmine received a handwritten note from a 74-year-old man in Kentucky. I watched you speak. I don't agree with everything, but I felt like you remembered me. That counts. Caroline got a message from a small business owner in Texas. I didn't think anyone in D.C. cared about waste. You proved someone does. Keep pushing, but listen too. The bill's fate was still undecided, but something else had shifted. A movement had begun, not around sides, but around stakes. Not about who shouted louder, but who listened longer. Who carried more voices, not just louder ones. This wasn't a political battle. It was a citizen's test. And now the choice belongs to you. Your clinic, your pharmacist, your grandchild, your conscience. The debate is over, The responsibility is yours, so is the power. Now we want to hear from you. Have you or your loved ones been affected by healthcare gaps in your community? Do you think reforms should prioritize cost savings or access? Share your story in the comments. And if this message resonated with you, hit the like button, subscribe for more real conversations, and share this video with someone who needs to be part of this dialogue. Your voice matters. Let's make it count.